Millions of seniors and people on disability out there struggling, just essentially surviving on their Social Security checks. And sometimes, when, as they say, life happens, you get a flat, your car breaks down, AC breaks down, whatever the case may be, people have to resort to use their credit cards. And credit card interest rates are just way, way too expensive, anywhere up to 25, 28% for credit cards. So there might be some relief in sight. So let's talk about that today. And this is also going to be a live Q&A. So I'll talk about what's going to happen here. Hopefully, if we get active and we reach out to our politicians, I'll talk about that for just a few minutes here. I want to publicize this as much as possible, and then I'll get into the live Q&A. Looks like we've already got a bunch of questions. Help you get all your benefits from Social Security, Medicare, Medicaid, retirement, disability, and all the rest of it. Okay, so strange bedfellows. Someone just put a remark on there that Bernie Sanders is not strange. You got to admit he's a little bit he's an interesting character, but the fact that what's strange is Josh Hawley. I mean, we're talking the very, very right of the political spectrum, senator from Missouri and independent senator from Vermont, Bernie Sanders coming together. That is, you got to admit, that is very, very strange and on a policy. And I think this is great. So it shows that there's wide support for this. So what is it? It is they are trying to cap credit card interest rates over the next 5 years. They want to cap it to 10% rather than 20%, 25%, 28%, whatever it is now. And this was actually also supported back in September by now President Trump. He said, while working Americans catch up, we're going to put a temporary cap on credit card interest rates. And he said, we're going to cap it around 10%. We can't let them make 25 and 30%, these companies, banks and issuing credit cards. And let's see here, we've got Bernie Sanders says when large financial institutions charge over 25% interest on credit cards, they are not engaged in the business of making money, of making credit available. They are engaged in extortion and loan sharking. We cannot continue to allow big banks to make huge profits ripping off the American people. And then Josh Hawley says working Americans are drowning in record credit card debt while the biggest credit card issuers get richer and richer by hiking their interest rates to the moon. It's not just wrong, it's exploitative and it needs to end. I agree 100%. And my community, y'all always reach out to your politicians. We're trying to reach out to them so they will save Social Security so we won't get those cuts in the future and also improve customer service. So here is your time to act. If you are not struggling under these high interest rates where you just pay the minimum and you're just kind of stuck forever, I'm sure there's somebody in your community, somebody around you, a relative or friend that are. And if they're just living on Social Security or very minimal, it's very, very tough. So please, even if this doesn't apply to you, look out for those around you. Call your senator, call your representative and say, hey, I heard about the odd couple coming together to reduce interest rates. I am 100% for that. Call the president. So here's the switchboard for the U.S. Capitol, the switchboard for the White House. Go on to these politicians' websites, social media, a full blitz, and say, hey, yes, I support it. If you don't support it, we want you to support it. And who doesn't support it? Well, guess what? Credit card companies and the big banks that are making tons of money on these interest rates. And, it's the poor people that are paying these essentially, because if you have really good credit and you probably your interest rate on your credit card, even if you use a credit card, is very, very low. And those are actually people the credit card companies called deadbeats. A deadbeat is in the credit card industry is basically a customer that uses the credit card and then pretty much pays it off every month. So they the company gets no interest, no real profit. They obviously get a small percentage when you go to the retail store and buy stuff, but they're not making the big profits. So these credit card companies make the big profits off of the people that are just can afford that to pay those trillions, billions of dollars. So reach out to local news, social media, and there's three more things that you can do. Wherever it is, that right there, smash the cap. What are you doing to improve customer service? And what are you doing to make sure the cuts of Social Security don't happen here in the future? Okay, so I just wanted to bring that out there, and we definitely need to get active and make sure that gets done. Let's move into the question and answer part. And we've already got tons of questions here. Um, so if you're just sticking around for the credit card stuff, then have an awesome day, have an awesome weekend. But if you're here for some questions, make sure you type your questions down into chat. Dimple, I am 71 and wife turned 62 in July. I have zero work credits. Am I entitled to any SSA, Medicare, or any other benefits? Absolutely. You do not have to be insured for benefits under your own record because you're currently married. Your wife is 62, turned 62. If you're currently married, then she has to file for benefits first. So she files for benefits, and then you file. You technically have to file for benefits on your own record, and then Social Security Administration, the employee said you're not entitled, and you just say, yeah, I know, duh, I know that, and then they take a spouse claim for benefits on her record. But Medicare, you're 71 years old. You may or may not be penalized for Part B and Part D. If you have had health insurance from work, yours or your spouse's, since you turned 65, and that employer has 20 or more employees in that group health plan, then you're good. But if you haven't signed up for Medicare in the last 6 years since you turned 65 because you thought you weren't insured, you still had to have signed up, and you just had to pay for Part A, which is good. It's a lot of money. Most people don't have to pay for Part A because they're insured. But if you weren't insured and you didn't sign up, then you might have to. But maybe you weren't insured because you work for a government entity that did not pay into Social Security. Um, so if that's the case, you paid Medicare though. So a lot of people don't know that 3% of the people that Social Security Fairness Act was just recently passed about, those people didn't pay into Social Security part of FICA, but they paid into the Medicare part of FICA. So maybe that may or may not, you know, uh, pertain to you. All right, let's see what else here. Justice 5-6. I'm 68 and 4 months, was trying to wait to receive Social Security until 70, but feel concerned that it won't be what I am entitled to. So maybe I try to get what I can now. Big decision to make based on guesstimate. Yikes. Yes. I've been doing this for a few decades, and I've always told people for those few decades, no, don't, Social Security, the politicians are finally going to wake up and do the right thing and make sure those cuts don't happen in the future. And or we as people are going to wake up and make sure our politicians do the right thing. But neither of those things have happened, and the cuts are. Oh, I chose the wrong graphic here. The cuts are going to be happening within a few years here, unfortunately. But we still have time. We still have time to fix this. But yeah, in terms of retirement and when you take your retirement, early retirement, there's questions you need to ask yourself. Do you need the money? If you need the money, then it's a slam dunk. If you're working over the annual earnings limit, this year is the 23,400. It may or may not be good, to take those benefits. Are there other people waiting to take benefits on your record, spouses, children, or something like that? How's your health? How's your genes? Is it going to put you in a higher tax bracket? Can you invest this money? So those are all the decisions that you need to ask yourself if you're deciding when to start your Social Security benefits. And that last one I added relatively recently, not because of presidential election or whatever. It's just we've been kicking the can down the road for way, way too long, and there's no more road. And so any fix we do is going to be tough now because we have waited so long. So, Nilda Acosta, thank you very much. $5. I appreciate it. You're so awesome. Thank you for the support. Got my coffee IV for the day. Thank you. My sister-in-law is taking the divorce check from Social Security from my brother. She went overseas and married there with another man. Why is she still receiving money from Social Security? Yeah, if the year so this is actually from your brother. If your brother is still alive, then her benefits should have stopped. You can continue benefits from a surviving spouse, from a deceased spouse, if you remarry after 60, but sounds like that's not the case. So, yeah, her benefits should stop. If she gets remarried, her benefits from her previous spouse should stop, unless that previous spouse is deceased and she remarried after the age of 60. So, it is not strange that Bernie is fighting for the people. I agree. It is not strange. It is strange that to see those two hook up, not hook up, but anyway, you know what I mean. I heard today that they are going to get rid of Medicare slash Medicaid Advantage plans. And this is this true? I can't qualify for a supplement plan. Um, well, I'm keeping an eye on all this. So Medicare, Medicaid Advantage plan. So you're talking about the Medicare Advantage dual eligible plans. Um, One thing I see in the works, which we will know more in details once those in charge of the House of Representatives come out with their plan here pretty soon. Their one of their targets is Medicaid. And if you lose Medicaid, then yes, you will lose that Medicare Advantage dual eligible plan. Those are the ones with all the extra benefits, So yeah, and if you lose that, if you lose your dual advantage plan, you just might have a special enrollment period so you can get a supplement plan. So yeah, there's a lot of people that what is it, 1.8 million plans were essentially canceled. Companies, leaving the entire state of like Missouri and different places, but they're people, the companies, the health insurance, Medicare companies leaving this particular area, that particular area, dropping these plans. So about 1.8 million of those plans were dropped this last season, and unfortunately, there's probably a lot of people out there that don't know that, didn't open their mail or whatever. They haven't gone to the doctor yet, so they don't know their plan is canceled. So you still have an opportunity now. We are in the open enrollment period. January, February, March is the open enrollment period. So if you have a Medicare Advantage plan, you can check to see if you're still in the best plan. Reach out to your Medicare people, your Medicare insurance. You can reach out to my partners at Chapter. They can help you out 100% free. Reach out to them and say, hey, I got this plan. I forgot to check it when I was supposed to check it, but can I get a do over? And yes, you can. Or I was pressured into, signing up with this company. I don't feel good with it. Can I switch to another plan? You can do that. And so if you do it this month in February, your new plan will take effect March 1st. So it's good to go ahead and get that started as soon as possible. If you do it in March, it will take place. Your new plan will start April 1st. And then, so this is an opportunity to do that. And this is also an opportunity if you have a Medicare Advantage plan and you want to switch back to original Medicare and get a Medicare supplement, then now is the time to do it. You'll probably, depending on your state, you'll probably have to go through health underwriting, which they ask you some questions and to make sure you're healthy and stuff like that. But yeah, if I always recommend Medicare supplements, checking out Medicare supplements first. But if it's not right for you, usually it's a monetary issue, a budget issue, then Medicare Advantage. But you just have to stay up on your Medicare Advantage a little bit more. There's more effort. My Social Security is more than twice my husband's because of his WIP. I mean, WEP, maybe windfall elimination provision. Can he file on mine now under the WIP, the eliminated Social Security gives in full Social Security amount? Married 45 years. Wow, married 45 years. Awesome. So awesome. All right. Yes. Um, if he has already filed on your record but he just didn't receive anything because his benefit was calculated under the old system, then you should be good because he is on your record and Social Security is working on that now. If he never filed, then yes, you definitely need to call Social Security. And this is for those millions of people out there, if you were ever married to someone that worked in the federal government before the 1980s, started working in the federal government before the 1980s, part of the old the civil service retirement system, or if you were married to someone that worked in a state or the local city government that did not pay into Social Security, you definitely need to reach out to Social Security and see if you're entitled to benefits on that person's record. You might not have been entitled before, but you might be entitled now. Liz, thank you very much for the support. You're awesome. Thank you, thank you, thank you. Bernie is one of the greatest. Let's see. I'm jumping around here a little bit. CalSTRS, California State Retirement System, CalPERS, California, yep, local agency. Yes, those. So if you work for those particular entities, for example, or the Texas Retirement or Nevada has one. And so, yeah, Chicago. And so let's see. Legal loan sharks. Yeah. Wow. 28. Yeah, I agree. 28%. That is crazy. All right, let's see. Jumping around. Yeah, those rates used to be illegal, considered loan sharking. I've seen them at 35. Wow, that's when get benefits when you work and 1 week of pay falls in the next week. How do they figure they will deduct 1 week if you get paid biweekly? Okay, what are we talking about? Retirement benefits or disability benefits? I'll answer this based on retirement. Um, that so the only time that would be relevant is if this is your first year receiving retirement benefits and they've gone to a monthly. So if that happens, sometimes the computer system will pick it up. Most of the times it won't. And you're going over the 1950, and you just have to go down there and say, yeah. They just paid, the following month, a month earlier, a day earlier. So they can kind of average it out. So you should be good. So. And again, I'm assuming you're asking about early retirement. My husband is 65, does not qualify for Social Security on his own merit. I'm still working, but he doesn't work. Will he qualify to apply for SSI? SSI is the welfare-based program. It takes your income, income resources into account. I assume you're probably talking not about SSI, the welfare-based program, but you're probably talking about just regular Social Security. If he's not insured, and you haven't filed, then he wouldn't be able to get monthly benefits. If he's disabled at 65, or actually, you don't have to be disabled at 65 for SSI. That's the welfare-based program. But again, that's, they'll take your income into consideration. But again, if you're talking about regular Social Security, and you won't be entitled because he's not insured. But as I just talked about a few seconds ago, because he is 65 years old, he has to apply for Medicare unless he has health insurance through your current work and your employer has 20 or more employees. If he does, then he doesn't even have to sign up for Medicare. If he doesn't, then he has to sign up for Medicare, even though he does have to pay for Part A and Part B. Everybody pays for Part B. So, Rita, can I get a percentage of my husband's Social Security income? He's retired and he makes a lot more than I do. Yeah, if you have to be receiving benefits on your own record, and then if his full benefit amount is twice your full benefit amount, then absolutely. Living on Social Security and now am 15K in the hole because of COVID. I don't know what to do. Yeah. Make sure you watch my video. I've done it a few times, but the last one, about a month or so ago, I did a video on living on Social Security alone. Make sure you check out that video. I've got like 50 different programs or ideas out there that might make your life a bit easier. So make sure you check out that video and get a piece of paper and a pen and say, okay, well, let me check this plan. Let me check this out. And yeah, um, let's see. Bernie is good for the people. I don't care if he comes to work in a pink tutu. Yeah. I'm sure I can find a video on that. Well, with AI, you can make a video of Bernie Sanders dancing at a pink tutu. Yeah. So anyway, I turned 70 July 20th. When I apply for benefits, what date should I put down for receiving benefits so I am not penalized 8%? I am still working full time and will continue to do so. You should start in July. You are going to receive the maximum delayed retirement credits when you start your benefits the month you turn 70. So you turn 70 in July, so put July. Start your benefits in July because the in August you're not going to get an increase based on delayed. Let's see. My husband is on Social Security, disability, and I collect retirement Social Security. Can I file on his disability since it's more than mine? So he's on disability and you collect, yeah. So you're already collecting Social Security benefits. If his is twice your benefit amount, then absolutely. You call Social Security and say, hey, I'm receiving benefits, but also my husband's receiving benefits. Is his primary insurance amount, which is the amount at full retirement age, is it twice your full benefit amount? Not what your check is, but your full benefit amount. That's what they look at. They look at his full benefit amount, the amount at his full retirement age, which is the same as disability, and they will look at your full benefit amount, the amount you would have received if you waited till your full retirement age. And if one is twice the other, then yes, you will get more benefits. Michael, another donation. You guys are awesome today. Thank you very much. Supports my my caffeine addiction and helps my son out. You guys are awesome. He is my assistant and does everything behind the scenes. We'll be getting our regular Social Security payments this month. I can't get into my account. I haven't heard anything different, but maybe send an email to Elon Musk and see if or one of his children, his 19-year-olds, and yeah, this is yeah, and see if they'll give you access. Anyway, 6.5 million Social Security recipients over 112 are collecting Social Security money. No, please, come on. We need serious. This is serious times, and we need serious solutions to solve Social Security and these internet myths. This same thing has been. I think the last time I saw that was 2015. The same exact article went out in 2015, 10 years ago. So this goes out every now and then. All right, let me go through it one more time. We need to be serious. You know, the politicians love to distract us with BS like this so we can go off on this wild goose chase and then they can pick our pockets and give our Social Security trust fund over to their billionaire buddies. But this is one of those distractions. All right, so this is the same thing. It was 6.5 million back in 2015. And so that was, 10 years ago. What it is that there's Social Security numbers out there, and Social Security legally, unless Congress, and this is what's crazy about it, Congress can just tell Social Security, okay, if these Social Security numbers that are still active, they're whether they're still there, um, but Social Security can't shut down that Social Security number because they don't have a death certificate. So all Congress has to do is say, well, go ahead and shut those things down. And here's your authority to do so. And then Social Security can go ahead and shut those down. But there's nothing happening with those 6.5 million. They're not receiving money. Did people receive money? Yes. If you passed away yesterday and your check is due today, you get it. But once your coroners or your funeral home notifies the Department of Treasury, they fill out the form, they fill out the death certificate, and it has on the death certificate, it has a Social Security number, and that goes to the Department of Treasury, and Department of Treasury goes in there, yanks it out, and then politicians come in and say, deceased people, dead people are receiving Social Security checks. Well, yeah, if you, yeah, and tell Department of Treasury takes it out there. And yes, there are times when you have a child who is dependent on that money and mom or dad passes away and they just leave mom or dad in the in the bedroom and seal the door and so they can continue to get the checks. Yes, that does happen, obviously. But yeah, this whole thing about 6.5 million, we need to be serious. So my sister worked and retired from the DoD and was under CRS. Will she fall under the Fairness Act? Yes. Yep. Civil Service Retirement System, the old system. So that means well, again, she also had to pay into Social Security, the Social Security part of FICA. So she had to work at some other job and actually be entitled to Social Security. If not, then no. If all she did was work at DoD and never paid into Social Security, then it wouldn't apply to her. Angela, hey, Dr. Ed, thanks for your service. You're welcome. I'm now full retirement age, still working, making 80K a year, and I don't plan on ever retiring. You and me both. I'm going to keep doing this until I lose all my hair, which next week. I just filed my Social Security benefits. Will my Social Security increase as my salary increases? Thanks. Yes, absolutely. Um, if that's one of your high 35 years. So if you, unfortunately, you will continue to pay FICA taxes even if you're collecting Social Security. You'll pay FICA taxes and regular taxes forever. That's the inevitable, unfortunately, unless you're really rich. Um, but if that's one of your high 35 years, so what happens is, you work. Last year you worked, you made $80,000, $800,000, whatever the case may be. That means you paid that at Social Security. Once you file your taxes, IRS notifies Social Security. Social Security looks at it and says, "Hey, Angela worked last year, and was this one of her high 35 years of earnings?" If it wasn't, then no change. If it was one of your high 35, they kick out the low one, stick in the new one, recalculate, and your benefits go up. So, um, Rita, if anything happens to my husband who is retired, do I get his benefits? Do I get a percentage or the whole amount because he makes more than I do? Um, if his benefit amount is higher than yours, yes, you're eligible for benefits on his record if you're currently receiving those, benefits on your own. What percentage? It really depends. Survivor benefits are there's too many. There's several variables, but if you start those benefits at your full retirement age, then you'll get 100% of his benefit amount, or his full benefit amount or delayed retirement credit. So you'll get 100% of what you're ever entitled to, whatever. It depends on whether he filed early or delayed or whatever the case may be. So there's a lot of moving parts on that one. Doc, why can't you pay your credit cards off in full? Yeah, because people just unable to do that. So if I have insurance through my spouse's work and I am going to have to enroll in Medicare because I've been approved for SSDI and it's been more than 2 years, what do I need to do or worry about? If you've got insurance through your spouse's work, you don't have to do anything. So you were approved for SSDI, and so yes, your Medicare will start in 2 years, and it'll start automatically. They'll send you your cards, but if you are receiving health insurance from your spouse's current work, and that employer has 20 or more employees, then you don't have to do anything. And obviously, if you check, you compare apples and apples, you'd say, well, my your spouse's insurance is good, or is it better than, is it cheaper, and does your employer make you sign up because now you're eligible for Medicare? But yeah, but if you don't want it, and it's your spouse's insurance is better and cheaper and all that kind of good stuff, then all you do is you refuse the Part B Medicare. And that's the one that costs $185. You don't need it. You just refuse it. You cannot refuse the Part A, but that's, zero premium anyway for you. That covers the hospitals. But yeah, you don't have to have Part B or Part D or get a Medicare supplement or Medicare Advantage or any of that if you're happy with your current plan. I heard today no taxes on Social Security per Trump press secretary. Will you comment? Is it true? Well, I'd like to see it when I see it. I'm going to do a video on that on taxes probably next week and go through whether it's good or bad and who is it good for and who is it bad for. And guess what? It's bad for people that for people that are already struggling. So, doctor, I just wanted to say you parrot shalom. Okay. John called a friend of mine, told him because of the repeal of the GPO, he would qualify for spousal benefits. He had no idea. He now has a phone appointment and set it up. Awesome, John. There we go. We can call it a day. We've saved we've awesome. This is what it's all about. Awesome community here. There's a lot of people. So your friend would have just gone on and lost all those benefits. So I know some of y'all know situations like that. That's what this, main part of this channel is about. Don't think about yourself um, only. Think about those around you. So John reached out, and that person just might get some more money because of John and because all the people that press like and subscribe and all that kind of good stuff. So thank you, John. I appreciate it. Oh, okay. Here's a question that I got a lot. I did a video yesterday on working on Social Security, and I might not have mentioned it. So thank you, Lisa, for this question. Is the amount you make a month go by net or gross? So good question. Um, if it goes, if so, we're talking about early retirement. So you're limited to the amount of money you can make once you file for early retirement. And this year it's the $23,400. And unless, you're talking about when you hit your full retirement age that year. But it's gross when you're talking about W 2. So if you just work for someone, get a W 2, then it's gross. So people say, well, I get, $20,000, but 5,000 of that goes to a 401k and goes to an alimony. No, yeah, sorry. It's the gross. Net is net income from business. So if you have a business, selling, your sales are $1 million, but you have $999,999 of, costs, then, so it's net for self-employment. So I want to buy a coffee. Please remind me where the tab is. Oh, thank you. But yeah, if you're unable, if you're unable to find it, the sentiment is sufficient. I appreciate it. But it's in the I think the whatever chat you're on, it has it on there. But you can also go in the description on YouTube, and there's a little button there that says coffee. I appreciate it though. You're awesome. Um, if wealthy people pay FICA with their whole paycheck, will they get a much higher payout from Social Security? All right. That's a good question. So that's one of the reasons Social Security is, in such dire straits right now, that there's going to be a cuts across the board if we don't do something. And one of the reasons is since the 1980s, so much of the extra money coming in goes to the top, and they don't pay FICA Social Security on anything over $176,100. They pay up to that, but they don't pay anything over that. So all of that money, our wages have been stagnant for since the 80s. So the money that would normally pay into FICA doesn't pay into FICA anymore. So that's why the Social Security is such in dire straits. So, but as people who watch my channel on a regular basis know that the more you earn, the less replacement rate percentage you get. So if your average earnings throughout your life are $1,000 per month, you will get when you retire at your full retirement age, 90% replacement. So your average earnings are 1,000, you're going to get $900. If your average earnings throughout your life was $10,000 a month, you're going to get 35% replacement, not 90%, but 35%. So you'll get $3,500. So the more you pay into it, the less. So there's what's called these bin points. There's a 90%, 32%, and 15%. So they can just cap it, or they can add another bin point and say, okay, there's going to be 90%, 15%, or excuse me, 90%, 32%, and 15%. And then we'll add another one for the really super wealthy is, 0.2, and we'll name a dog park after them or something like that. So those are the solutions. And you can see those solutions in my YouTube description where it has the actuary. He does all the calculations and says that will solve a great amount of the issue. It would have solved 100% of the issue if we had done that years ago, but every year we wait. Yeah, it's not going to solve as much because we waited too long. Oh, Elvish, another support and burnt popcorn. Thank you. We boomers are nervous over the Elon BS. Yes, I agree. Yeah, that's the whole thing about unelected bureaucrats making decisions for you. That used to be a big issue several weeks ago, but I guess it's not anymore. So, can you comment on the 6.5, 112 Social Security recipients getting money? Oh, okay, yeah, I just commented on that one. It's all BS. So it's all distraction. And yeah, and it came out. I did a video on it a few weeks ago. Senator Johnson out of Louisiana. Louisiana seems to be the center of trying to destroy Social Security. All the politicians there, I think they've joined together and say we're going to kill it and give it to our buddies on Wall Street. And so they're he did this whole. He started it again. Again, it was started. That same BS was started in in 2015. And so, all right, if I know my earnings will not go up in the next 4 years when I retire, will I receive the amount shown for this year? Um, so you're looking at the My Social Security and you're looking at the website to see, um, then it's probably going to be accurate. Because what happens is on when you go into SSA.gov and do the My Social Security, you check and see how much you're going to get at 62, 65, 70, whatever the case may be. Yes, it kind of projects forward and it assumes that you're going to make about the same you did last year. You're going to make about the same this year and next year. So yeah, if your earnings are not going to go up or down too much, then they're pretty accurate. Yep, pretty accurate. Can you talk, please, about original Medicare a little bit? Is it better than other? 100%. Original Medicare, I always recommend keeping original Medicare Part A and Part B. And in order to keep Part A or Part B, and look, if you've got a few $1 million, sitting around, then you're done. You don't need anything else. But most people don't. So with original Part A and Part B, you also have to get something to cover all those gaps because there's a lot of gaps. The big one is Medicare Part B has a 20% co-insurance. So if you go to the doctor and get a $100,000 Band-Aid, Medicare will cover 80%, but you have to cough up the other $20,000. So that's why people get a Medicare supplement or a Medicare Advantage. When you get a Medicare Advantage, you're essentially giving up original Medicare and you're giving all your healthcare issues control, help to private insurance companies and Medicare Advantage. But when you have a Medicare supplement plan, those are still run by private insurance companies, but they have no say on anything, basically. When you go to the doctor, if the doctor says you need X, Y, and Z, they do not need prior authorizations. Doctor just does it. And then the doctor bills Medicare, and let's say the Medicare pays 80%. And then depending on the company, but most companies, they've got a computer that talks to the Medicare company, the Medicare computer, and Medicare says, hey, we just paid 80%. You need to cough up the other 20%. And the insurance company coughs up the other 20%, and it's done. You don't have to ask, prior authorization if you have a Medicare supplement, and you don't have networks when you have Medicare supplement. If you can go to any doctor or clinic or hospital in the country that takes Medicare, if with so that's why no prior authorizations, no networks. So that's original Medicare with a Medicare supplement, and Medicare supplements they're the standardized nowadays. The big ones are Plan N or Plan G, N as in Nancy or G as in George. So you can reach out to Chapter there and they can see what's available. So a lot of people, I think everybody should get those, but there is a premium. There's a monthly premium for those Medicare supplement plans. And then you also need a prescription drug plan, there's a little premium on those too. So unfortunately, some people just can't afford them. And so they go the Medicare Advantage route, which, most Medicare Advantage has, zero premium, but it's a kind of a pay as you go system. Um, so, yeah, I always recommend checking out a Medicare supplement first. So if you're turning 65 or you're new to disability and you're about to get Medicare and everything, you know, whoever you talk to, always talk to a broker. Avoid captive agents, agents that work for like one company because that's the only company they're going to, recommend. You call a broker who, can look at all the companies in your area and then decide, give you your options. And Chapter does that. But yeah, you check out a Medicare supplement and it says, hey, tell me about N and G. What's the difference between N and G? How much is it in my area? Can I do it? And, and then if you just can't do it because of a budget issue, then you go down to a Medicare Advantage and then, they check to see which one is the best one based on your doctors, your prescriptions, and the costs. And then look for all the special bells and whistles, gym membership and, transportation and stuff like that. But always focus on the doctors you want to go to, the prescriptions and the costs. You're like, wait a second, zero premium, but they still have costs. So, Medicare Advantage, if you have you go to the hospital, you might have to pay $100 a night or $200 a night or $300 a night. If you get an MRI, it might be $20 or $500. It really depends on your particular plan, whatever you choose. And a lot of people, unfortunately, just don't pick, they don't spend a lot of time. And yeah. I'm 71, widow. I get a pension and Social Security. Am I at cap amount? Am I entitled to any of his salary, Social Security benefits? Yeah, I'm not sure. So you're getting benefits on your own record. Are you getting surviving spouse, widow benefits as well? Since you're 71 years old, I would, if you haven't been getting, it, so here's one of the big things that people make mistakes on is when you're eligible for survivor benefits, you can get survivor benefits and don't touch yours. If you're getting regular spouse benefits, that is, divorced spouse or current spouse or whatever, that person is still out there alive and kicking, you have to file on yours first. But with surviving spouse benefits, you don't have to file for benefits on your own record first. You can start receiving survivor benefits and then don't touch your own, and your own continues to increase up until 70. So maybe benefits on your own record might be more, or surviving benefits. It really depends on the amount. So I would definitely, if you haven't been getting both or any of those, I would definitely call Social Security and see if there's any more out there. B Mike, thank you. I'm still waiting for Social Security to complete part 3, hopefully to start my spousal benefits. Thank you for your support. $5. Awesome. Um, part 3. Hopefully to start my spousal benefits. Part 3 of starting, yeah, yeah, this gives you an idea of how backlogged Social Security is. I've taken hundreds of thousands of spouse claims and, surviving spouse claims, current spouse, divorced spouse, and you go into the office in the old days when you could go into the office and, you provide your ID and marriage certificate, divorce decree, or whatever the case may be. If you have all your documents, um, you know, that's it. I take the claim and then push the button and your check is on the way. So step 1, step 2, step 3, step 18, it's all done within 30 minutes. But unfortunately, yeah, because Social Security is at the lowest staffing in 50 years, everything is taking way, way too long. So while you're waiting, what do? You contact your politician and you say, "Hey, I know you and your buddies on Wall Street are trying to kill Social Security so you can take it over, but we don't want that." So reach out to your senators, House of Representatives, to call the White House line there and say, "What are you doing to improve customer service?" Because customer service is all about Social Security helping you get the benefits you're eligible for, entitled, and need. And politicians don't want that to happen, I guess, and that's why they're essentially cutting back staff and making it more difficult for you to get the benefits you need. So reach out to them and call them on the carpet for that. Let's see. I'm jumping around here a little bit. I'm receiving SSDI and my phone newborn as well. Does my young wife taking care of my child qualify for benefits? Um, Okay, so you're receiving SSDI. Yes. If you're receiving Social Security disability benefits, retirement benefits, and you have a child under the age of 18, yes, they are eligible for benefits on your record. And then you're asking about the child and care benefits, AUX child and care benefits. So if your wife is essentially not working or staying under the annual earnings limit, staying home to take care of the child, and that child is under the age of 16 or became disabled before the age of 22, yes, that parent is entitled to benefits. There's what's called a family max. There's a maximum that can be paid out on a particular record. So if your benefit amount is very low and your family max is very low, then your child might get all of it, and there might not be anything left over for your wife. But I would definitely check it out at that time, and they will tell you exactly how much your benefit amount is. Each of them get up to 50% of your full benefit amount. Who would you call if you suspect someone of Social Security fraud? I've got that link in my description as well of YouTube. You call the OIG. Or you go online, you can do it online. Just type in SSA OIG. I think the OIG was fired by President Trump. But there's still staff there, as I think. What would be a good investment to put my Social Security into? Also, can it be direct deposited into a high yield savings account or an investment form? Yeah, as long as basically you have a routing number and an account number, and you can put it wherever you want. So overseas, got a Swift code and all that kind of stuff. But in good investment, yeah, I don't do that. Um, Minoxidil, anyway, 30 years ago. Trump said there will be any changes to Social Security Medicare based on the billions of horrific spending that USAID has done. We will money lots of it. Um, yeah, but that's a terrible answer. I've talked about that several times. When a president, doesn't matter who said it, I'm not going to touch Social Security. I'm not going to touch Medicare. Okay, great, but that's also a terrible answer because Social Security is essentially on fire now. The trust fund is running out. The baby boomers are using that money. It's their money. They're taking it out. So obviously it's going to run out. Um, and then everybody's going to get cuts across the board. So don't touch it is not a good answer. It needs to be touched. It needs to be fixed. And then USID, people think, anytime a survey is done and how much we give to foreign countries for aid, people always said it's about 20 or 35% or something like that, 26%. USAID is less than 1% of the budget. And yeah, if you actually look at the details of it, then again, it's distraction. And we're smarter than that. I took Medicare A at 65 because I'm still working and have insurance. Now I'm going to need surgery and want to have Medicare Part B and a Medicare gap. Do I have to retire to do this? Can't get Social Security until 2026. No, if you just essentially stop your health insurance from work, and you can switch. You just have to in order to sign up for a special enrollment period for Part B. Well, actually, you don't need a special enrollment period because this is a general enrollment period right now, January, February, March. But in your case, um, you have to fill out a couple of forms. One of them is the 40B, and the other one is a 564. You take the 564 down to your employer. Your employer verifies that you did have health insurance from work, and you don't get the penalty, and then you can start it. And then you reach out to chapter there, and they can walk through that process and find out what the best G is in your area. Well, they're all the same. It's just about a price. So Elon is already into Medicare and Medicaid. If he gets his way, there won't be anything to be entitled to. Yeah. Um, wow. And he's got all those kids on there too. So, and I guess they just said he is going to be walking into Social Security here soon. So I'm keeping an eye on that. I am on Social Security. I got a paper statement from Social Security that stated they paid me $12,000 for 2024, but they state they sent back $4.85 to or 4,000 to Social Security. I only get 8,000 for 2024 payments. Yeah, it sounds like you had a corrected 1099 that you got the benefits, but then you worked over, so you had to pay back. So yeah, make sure that you submit the correct one to the IRS. Barbara, welcome to Silver. Became a member. You are too awesome. Thank you very much. I appreciate it. Let's see. I'm 63. Receiving SSDI. Okay, I already answered that one. Let's see here. Um, I had Medicare Part B, but dropped it because it was too expensive for me. I have medical insurance through teachers' retirement system, so I dropped Medicare. Oh, okay. Now penalty to get it back. Yes, because it's um, the other health insurance you're getting is not from current work. It's a retirement plan, and that's not considered credible coverage. So, yeah, unfortunately, if you decide at a later date or now to go ahead and sign up for Part B, which you can right now, this is the general enrollment period, January, February, March. This is, if you're going to go back to Part B, now's the time to do it. But yes, you will unfortunately have to pay a penalty uh, 10% for every 12 months you did not have Part B. And Part D, the drug plan, you'll also pay a penalty for that if you didn't have it when you were supposed to. And that's 1% for every month you did not have it. So, um, can you talk about caretaker benefits? We have a disabled 30-year-old child, home diagnosed age 3. She is collecting Social Security, SSI, Medicaid, parents both on Social Security, father 69. Yeah, so those are the child and care benefits I just talked about. Basically, if you have a child under the age of 16 or a child that became disabled before the age of 22, and that child is receiving benefits, auxiliary, it's called auxiliary child benefits, then the person, the other parent, who is essentially home taking care of that child, again, under the age of 16 or disabled before the age of 22, can receive benefits as well, up to 50%. But again, there's that family max. So I would have them, whoever you or whoever, call Social Security and say, hey, child and care benefits, is there any money left over? Can we go ahead and start that? And they will set up an appointment and go through all of it. Pretty easy to do. Done a few 100,000 of those, but a lot of people just don't know about them, unfortunately. So I was married for 25 years, divorced, remarried at 56, now 65. If I divorce now, can I collect on my first husband's Social Security? Yes. Yep. So if you're single, then you can go back to first husband, second husband, third husband, and whatever the case may be. And you're collecting on your first husband because it's more because of surviving benefits. And then your third husband passes away and there's more there that you can switch. Yeah. You always go for the most benefits. My husband is 67 and I am 72. His check is 2,700 before deduction, and after 2,400, my check is 1,300 before deduction. After it is $1. All right. So are those your PIAs or are those your MBAs? So that's important. Your PIA amount is the amount you would have received at your full retirement age. Your MBA is your monthly benefit amount. So let's say those are your full benefit amount. So, it looks very, very close. Yeah, after it's $1. So, but I would call to check because you're so close that I would confirm whether those are your PIAs or your MBAs. And you call Social Security, and it takes them a second to figure it out. Unfortunately, it takes 6 hours of waiting on the phone. But anyway, there's for that. Stacy says, yes, you do. I'm 73 and had an Advantage plan was canceled. I was able to switch because my Advantage plans was canceled. Yes. Yes. That's one of the, during this last annual enrollment period, there's a lot of people on my live Q&A that were like, I hope my Medicare Advantage plan is canceled. I really hope I'm one of those 1.8 million people that they cancel my plan, because if your plan was canceled like that, you have a guaranteed issue right to get a Medicare supplement without any health underwriting. So it sounds like Gary with two R's had a Medicare Advantage for years and wasn't able to get a Medicare supplement, but because his plan was summarily canceled, he was able to do it. So that's an awesome thing. So if I lived in Oregon for a year and then filed for EDD in California, I was told I would not qualify for EDD because I did not have earnings in California. I'm not. Yeah, that's not a Social Security thing. Let's see here. Wife wasn't eligible to collect on my record when she applied due to GPO. She is applying now on March 10th appointment. Will she be eligible for retroactive benefits for 2024? According to the way the law was written, HR 82, the whole two sentences of that law, typical Congress. Now, Social Security has to figure out all the thousands of little details on that, and Congress didn't give Social Security the resources to do this, so it's taken forever. But yeah, according to the law, she's supposed to be able to go back to January of 2024. So, I previously applied for early retirement benefits in May of 2023, but went back to work in June. I did call Social Security to let them know and suspend my benefits. Yep. Yep. So perfect. Um, and they will assume for 2024, 2025 that you're going to make the same. So whatever suspend or however much you told them you're going to be earning, then they will carry that over into the next year. So I think major cuts are coming. I think the government thinks we're all like dumb person. Okay. Yeah, I definitely agree that politicians think we are not very bright. I'm thinking about doing a video on that. Kind of a shocking title, but hey, politics. If I'll give you some examples of how dumb they think we are. I went to apply recently and was told my benefit would be the amount in 2023 because I did not withdraw. I didn't know I needed. Okay, I went to apply recently. I was told my benefit would be the amount because I did not withdraw. Okay. Yeah, not sure what that is. Vicky, my ex-husband is deceased. We were married 15 years. He was part of the WEP GPO, so I am hoping to get Social Security. I'm short for yep. So, but make sure if you didn't file before, you got to make sure you definitely file there. I'm grateful to have Social Security. It covers all my monthly expenses. I don't depend on anyone. I pay my own bills. Being a senior is a privilege, and I have all the coffees I want. All right, Tina. Yes, old Richard Pryor thing. You don't get to be old being dumb. Well, anyway, but yeah, every day above ground's a good day. So it's a beautiful thing. Glad everything is going perfect for you. Thank you, Ed, for your honest and sincere help for all of us who tried to navigate our way through the system. You're welcome. Thank you. Appreciate it. How far in advance and what date should I apply? I turned 70 July 20th. God bless you. You're welcome. Thank you. About 3 months before. So March, April-ish, May, June. Yeah, about April or May or something. But make sure before then you go into your Social Security account and check your earnings record because that's the most important thing to make sure Social Security has all the earnings you paid into Social Security correctly. So go in there and check that out. And if there's any issues, then you tell them at that time during your appointment. But yeah, start your benefits the month you turn 70. Lucy, I'm 60 years old on Social Security disability. Currently, my husband has applied for retirement benefits. He's 64. Should I keep my disability benefits and tap into his retirement benefits? Yeah, you keep your disability. A lot of people don't know this. That's another thing. Come on, like, subscribe, share. Um, when you receive disability benefits, if you're entitled to any other benefits, you can get those on top of your disability benefits. One offsets the other, but so you can get disability and current spouse benefits. If your disability amount is less than half of your husband's, then you can get benefits, those extra benefits. Well, not right now though, because you're 60. But when you turn 62, you can. But you have to, again, you have to be 62. But you can get disability benefits and spouse benefits, disability benefits and divorce spouse benefits, disability benefits and surviving divorce spouse benefits or surviving spouse benefits. And a lot of people, the reason eh, the reason people shy away from adding those benefits on top, even though it's more money every month for them, is because they think, well, if I get those spouse benefits or divorce spouse benefits or surviving spouse benefits or whatever, that means I'm giving up my disability and I'm going there. No, no, you're going to continue to have your disability. It just one is added on the top of the other. And again, one offsets the other, but there are extra benefits on top there. And then other people say, well, it doesn't matter. You're getting more money. Who cares if it's disability? Because when you have disability, you also have Medicare, and those people want to keep their Medicare. So you can have your disability, your Medicare will continue, and you get those other benefits on top. So Lester, thank you, Ed, for debunking the falsehoods. You're welcome. Yeah, there's just wow, there's just so many out there. It's crazy. Dr. Ware and those in the chat, I ran a little bit late getting here to the live streams. Hey, welcome, welcome, welcome. Yeah, the checks to the long dead people are a lie. Ask them for names, etc., and they will fold. Yeah, I'll just do as Google, and it says, yeah, been those, and I don't think they do it anymore because of a budget issue. But I know in my office we had it was called the Centenarian Project. And what it is anybody in our district, well, all districts across the country, if someone turned 100 years old, then we had one of our employees in our office, hey, Ronnie, go out to that person's office, print up a cute little certificate and said, congratulations on hitting 100 years old and, from the Social Security Administration. So it's kind of nice, but The other purpose, the ulterior purpose for it, the other purpose was to see if that person was still out there, and but they lost. I think most offices kind of lost funding for that, and so many people are turning hundreds nowadays, which is a beautiful thing. And so they have other ways. One of the ways is if you got someone, that's 100, not years old, and they haven't used their Medicare in a year or 2 or 3 years, there's a listing that comes out and says, "Hey, this person might not be out there." So, yeah, find out what's going on. So, Jeffrey, wealthy people pay FICA with their whole paycheck. Will they get much? Okay, I already answered that one. Uh, Thanks for all you do and your son are doing. You should have your son on and say hi. Yes, yes. Hey, Eddie. They want you to appear. He's the reason everything runs seamlessly, smoothly. Uh, it would run more smoother if I didn't mess stuff up all the time. So I don't blame him. So if I did it exactly like he told me to do it, everything would be a lot more smoother. But anyway, so there's that. Is there a way to find out the prices of meds before or after Medicare expenses? Yes. Yeah, you can go on to Medicare.gov and do like the Medicare Part D plan finder and stuff. And it's crazy. You have to be very, very careful. Um, because if you put in, a 30-day supply versus a 90-day supply, obviously, that'll come out different prices. But if you put extended release versus not extended release, sometimes it's like 4 times more expensive, and a capsule is more expensive than a tablet. And yeah, so you have to be very, very careful and make sure you put it in there perfectly, or you might get messed up. So, is it blanket through the Social Security system of getting any extra help that if you have any assets over 10,000 that you might simply not qualify for anything? Yeah, the only thing that asset that is asset related is SSI, the supplemental security income. Oh, I'm sorry. One more, the extra help with prescription drugs, but those are welfare based programs. Retirement doesn't matter. Survivor benefits doesn't matter. Spouse benefits doesn't matter. Medicare doesn't matter on any type of resources. But SSI, because it's a welfare based program, yes, there are limitations on how much assets you have, but they exclude things just like Medicaid and food stamps and stuff like that. They exclude your primary home and they exclude one vehicle. So you don't have to worry about that. So if you live in a $1 million home, doesn't matter. That's your primary. So it's not. Kathy, thank you for the $1.99. You're awesome. Thank you. Got your spouse benefits. Awesome. Good deal. I like it. We're just cooking like gas. Okay, my mother passed away in mid-February 2024 and received her March payment, but it was removed within about a week of it being deposited. So what Dr. Ed is saying absolutely correct. Yes. So Senator Johnson was this is he's the guy that restarted this whole internet myth. Um, and he knew better. He's one of the guys that started the whole thing that passed that act so Social Security could share the files and all that kind of stuff. They couldn't before because they didn't have congressional approval to do that. And then he helped give Social Security approval to do that. So congratulations on him. And then he comes back years later and says, "Oh," and tries to start that whole myth. So yeah, come on. He knew better, but he wanted to. They want to break Social Security, and one of the ways to do it. And again, the plan is in the description of my YouTube description. The plan is to demoralize people and make people distrust Social Security and start all these kind of internet myths. So it's easier to destroy. It's easier to give it all to the Wall Street billionaires, the trust fund, and everything, because people are just going to be completely fed up with the system and not trust it and have no faith in the system. And that's exactly the plan. So, and make sure you can't get in and call um, and that's yeah, they're doing very good on that one. Um, let's see, George. Hey, take and took. Hey, sweet Tweety Bird. If wealthy people pay into FICA on their total age, okay, yep, I already answered that one. Why is the richest man in the world being subsidized by us? Yeah, yeah, it's interesting. He's got also access to all his competition too, so he knows exactly all the competition for all his companies, all the competition, how much each of those companies are receiving, how much their bids were, and whatever. He's got all that information at his fingertips now. So yeah, that's worth an unbelievable amount of money. That type of insider information that him and his kids, not his personal kids, but his teenagers have access. But anyway, all right, wow, we're way over an hour. I apologize, we're out of time. I will be back again tomorrow. I think I'm going to skip Super Bowl, and I'll get to more questions to